Okay, welcome to episode 45 of the Sean McGuinness podcast. Today we have the pleasure of having on Patrick McKeown. Now, Patrick, I'll obviously save you the intro because you'd be sick of repeating at that stage. I always like to start with a question first. What bit of research do you have your head in lately? Does anything tickle your fancy?
I suppose I had an article published yesterday, and it was in conjunction with two ear, nose, and throat doctors, and it's looking at breathing re-education for obstructive sleep apnea, and it's a condition that's fairly common. It affects performance. It's in sports, especially with the bigger guys, rugby, weightlifters, etc. It puts a lot of stress on the heart, and it's putting the athlete or any individual into a sympathetic drive. And it doesn't help with recovery, it doesn't help with resilience. But by changing breathing patterns during wakefulness, we can improve breathing during sleep so that breathing is lighter and the throat is less likely to collapse. So that article was published in the Journal of Clinical Medicine, and it's a fairly high ranking with a good impact factor. So that was my latest piece of research. So it was just when I was involved. But yeah, it's great to finally get breathing out there in terms of sleep. And it would be tremendous to see sports scientists really start looking into the benefits, because there has been a few innovators in terms of sports scientists doing the research, but it hasn't become mainstream. And this is really where we want to see it.
So it saves you kind of, because from looking at your work, there's a lot of clinical trials and published papers published. And when you probably say it to some maybe more Western medicine, they probably think, that's a load of like pseudoscience kind of thing. But now at least you have research to back up your findings. I was even looking at the stuff
Got to do
with asthma before this as well. And that is proven. It's kind of it's pretty concrete at this stage.
I think the evidence is there, but for something to be accepted in medicine, it typically takes 20 years, and you need to have 500 papers on PubMed. And the issue with something like breathing is that it doesn't get funded by industry because it's not going to generate any money, and as a result, then it's kind of reliant on maybe institutions, but then institutions are not really going to think that breathing is that sexy. Like if you're a doctor or an upcoming doctor, you don't want to put your focus on breathing because you're afraid of what your peers are going to say. And there's a lot of that going on in it, whereas you want to look at what's the most cutting and innovative research, because that builds up your reputation. But this is the issue, Sean. It doesn't mean that breathing doesn't have something really massive to offer. And I came across this completely by accident. And you're talking about asthma. Even if we think of, you're in Australia, I'm here in Ireland, they are two countries with the highest asthma in the world. And yet, how many pulmonologists or respiratory consultants are actively encouraging their patients to nose breathe? And when we ask the question, what does the mouth do in terms of breathing? It does nothing. It doesn't filter the air. It doesn't warm the air. It doesn't moisten the air. It doesn't regulate volume. Mouth breathing is activating the upper chest. It's reducing oxygen uptake in the blood. This has been known since 1988. It doesn't harness nasal nitric oxide. When you breathe through your mouth, you don't have the connection of the mouth and the brain because the nose is actively linked with the brain as well. So, why is this being overlooked? Maybe it's just being too simple. And here's the real crux of it is, people can feel a difference pretty quickly. And I'm not exaggerating when I'm saying that. I remember 2 to 3 days into nose breathing, and it was a bit of a struggle. I was a mouth breather for 20 years. I always had chronic nasal obstruction, typical when you have asthma, because if you have inflammation in your lungs, it's going to travel up to your nose. And because of a stuffy nose, you're going to mouth breathe. And mouth breathing, then you're in that faster and shallow breathing. That's going to affect the mind. So you're highly strung. You're going to be more anxious. You have an increased risk of sleep disorder breathing, which is well documented in the literature. So here we look at, it's not just that, people will say that, well, the asthma is causing the faster and harder breathing. That's correct. If your airways are tightening, you're feeling suffocated, you're naturally going to breathe harder and faster. But it's the harder and faster breathing which is feeding back into your asthma. And it's the harder and faster breathing which is affecting the emotions. And it's the harder and faster breathing which is affecting your sleep. So people with asthma, they don't just have asthma. They are more likely to be anxious and they have also poor sleep. And if we look at the anxiety population, 75% of the anxiety population have breathing pattern disorders. And they're going from psychotherapist to psychologist to psychiatrist to medical doctor and doing all of this wonderful stuff. Who is looking at their respiratory physiology and who is looking at their breathing? And I find it amazing. I really do. And it's almost that I feel I give a talk, for example, to give you this example, and this will show you just how in professions we can be all very narrow minded. And I was, I'm going to put my hands up. Yeah, definitely. Same as that. Um, I gave a talk to 35 psychotherapists, and I talked about the importance of restoring functional breathing patterns for the mind. And I said, number one, if you have an individual with anxiety, they are likely to have breathing pattern disorders and they're likely to be chronically hyperventilating. And this has a physiological effect in the body. It arouses the central nervous system, it increases neuronal excitability. It can also affect their sleep. These same individuals will breathe faster, and that also causes agitation of the mind because it's not just that stress and anxiety causes fast breathing, but fast breathing feeds back into stress and anxiety. These individuals upper chest breathe, and upper chest breathing again is activating that fight or flight response. We need diaphragm breathing for the connection between the diaphragm and the emotions. They all found it very interesting, but they thought because I didn't believe in cognitive behavioral therapy, they weren't interested. And here is, you have a profession this is what we do, and we're afraid to look outside of this. But I was like that with breathing because I was focused primarily on the biochemistry. I was all into change breathing volume to improve blood circulation and to improve oxygen delivery. And that's what I focused. But I didn't focus on the biomechanics and I wasn't looking at resonance frequency breathing. And it was because I was trained in a tradition. And the tradition that I was trained in was the Buteyko method. And if you're trained in a tradition, you can't, it's almost that you're not allowed to deviate outside of that tradition because then you're no longer teaching that tradition. What are you teaching? So Oxygen Advantage was set up 5 years ago, 2015. And that gave me the freedom to look at anything in terms of breathing because I wasn't constrained by tradition. And if you think of all of the people who teach breathing, they typically teach it according to tradition. So we're talking about, say, for instance, the yoga instructor is going to follow the work of their guru. They're going to focus on the biomechanics. The heart rate variability instructor is going to follow the work of their field. But nobody is looking at breathing from three dimensions. And that's really, really important. And that's what I wanted to kind of open up because I think, the thing about breathing is that it's simple, but it's complex at the same time. And can you imagine a breathing technique that you can decongest the nose? Known since 1923, by the way. None of this is new information. It has been known for 400 years that if you sleep with an open mouth, you wake up feeling groggy. Now, despite that, 50% of the adult population wake up with a dry mouth in the morning. And if you wake up with a dry mouth in the morning, you're not likely to have a good night's sleep. You're more likely to have snoring. You're more likely to have obstructive sleep apnea. And you're more likely to feel you're waking up unrefreshed. And here's another one. Women's breathing is very much different to men's. And I'm sure maybe 50% of your listenership are female. This has been written about since 1905, that women's breathing is very much different. And women during the monthly cycle, post-ovulation between days 10 and days 22, there's an increase of the hormone progesterone, which is a respiratory stimulant. Their breathing can get faster and harder. Carbon dioxide levels can drop by 25%. And when CO2 levels drop, this is a gas in the blood, which is not just a waste gas. It helps to improve our blood flow. And it's also one of the factors that cause hemoglobin, which is the carrier of oxygen in the blood, to release oxygen to the tissues and cells. So people talk about bring in as much oxygen as you can and get rid of as much carbon dioxide as you can. What a load of nonsense. And it's the greatest load of nonsense that ever came into the public domain about breathing. It is so false and incorrect, and it actually could do harm because if you hear of people breathing harder and faster because they believe more oxygen is coming into the blood and from the blood to the tissues and organs, it's incorrect. But coming back to female breathing, Despite the impact of faster and harder breathing for 1 to 2 weeks every month for younger females, the impact it has on fatigue, on panic, on anxiety, and on pain, because when we chronically hyperventilate, pain thresholds lower and pain perception increases. So symptoms of PMS are very much influenced by breathing patterns, but yet most females are not aware of it. And the impact that this has on female performance, it has to be pronounced. It really is something here that's being overlooked, probably because most research in breathing has been done by men. And even the research done on women fails to take into consideration the fluctuations of hormones and the impact on breathing during the monthly cycle. So we have a long way to go here, Sean. If this was a product which was promised to generate millions and millions and millions of dollars, I guarantee you it would get research, but that's just
Hmm.
not the way it is. But here is the other thing. Look at the social and economic potential of this, giving people a technique. And for children, again, talked about for 100 years, you've got some tremendous orthodontists in Sydney. Dr. Derek Mahoney is out in Randwick, and Randwick, if I'm pronouncing it correctly. Um, and he's got a team of ear, nose, and throat doctors and orthodontists and dentists. And he has been looking at the impact of mouth breathing on childhood for probably for several decades. And yet, most parents are not aware of it. And it's really unfortunate because between 25 to 50% of studied children persistently mouth breathe, and it causes craniofacial abnormalities. The airways are not, they don't develop the way they should do. And the issues that develop during childhood, they're not just present during childhood, but they carry through to the rest of that child's life. And just, I'll stop talking in a second, but there was one study in Stratford upon Avon by Karen Bonnock, and she had it published in 2012, and it looked at 11,000 children over an 8-year period. Children with sleep disorder breathing, which includes snoring, and mouth breathing is a contributory factor. If untreated by age 5, these kids have a 40% increased risk of special education needs by age 8. So we wake up tired. If we have a bad night's sleep, it's like waking up with a hangover. But a child, if they have a bad night's sleep, it's affecting the development of their brain. We have to start looking into this. Where are the pediatric dentists in this? And where are the pediatric doctors in this? Because they have missed the elephant in the room.
Yeah. Oh, it's amazing, and a lot of that is very close to home for myself. I wish I knew this. I'm 30 now, and a lot of the stuff my parents would have noticed that makes sense to me now. Okay, and I suppose what you're saying there is the powerfulness of the generalist as well, and the holistic view. And when you know a lot of things, you can put that information yourself. I obviously did an undergraduate degree in psychology, and again we learned all the psychometric testing, all the behavioral therapies. But as I started to learn more about nutrition, I said, why is no one talking about nutrition in the development of the chemicals in the brain? And then obviously what you're talking about now, so 100% it needs to be intermixed. But well, I want to go back first from an evolutionary point of view. What way should we optimally breathe? Okay, because
Well,
it's obviously not
look
what
at look at the
people think
animal
it is.
world. Go out into the outback there and just check how are the animals breathing, and you'll see quite rightly they breathe nasally breathing. And look at the Aboriginal population before us as European settlers went in and messed their lifestyles up.
Yep.
And they were breathing, nose breathing, but they had really good development of the faces. And this is documented by a dentist back in the 1930s, Weston Price. You probably know his book, Nutrition and Physical Degeneration.
Mm-hmm.
So I remember I was in Lithuania. I was giving a talk a couple of years ago at a dental studio, at a dental surgery. And the professor there, she was a professor at one of the universities, and I can't remember her name, but she was commissioned with this task that during the invasion of Russia into Lithuania, and I think it was back in the 1917 or thereabouts, there were a few Lithuanian individuals who rebelled against the Russians. And the Russians executed them, hung them, and just threw their bodies into an empty grave in the middle of the capital city. Now, they found these bodies about 2 years ago, and she was commissioned with the task of trying to identify them, to reconstruct their skulls. Now, I looked at the photos of the skulls, and we had the professor of dentistry, we had ear, nose, and throat doctors, we had a number of, professionals there. And if you looked at the shape of these individuals' faces, it was amazing. The forward growth of the face, how well developed their airway would have been. They weren't like me. They weren't like me with a nose that's bent here because my maxilla is not far forward enough. And because my maxilla is not forward enough, my mandible is not forward enough. So my airway is screwed up. So I'd never have been an athlete. I'd never have been a rebel because I wouldn't have had the ability and the breadth to do what any endeavor that individuals need to do. And sleep is impacted. And I couldn't help just think, this is just 100 years ago. These individuals, what on earth has happened in 100 years that the shape of the human face has changed? And it hasn't changed for the better. We're eating soft food, we're eating crap. Um, Lack of breastfeeding due to society putting so much pressure on mothers having to go back to work because of the mortgages and everything.
That was one of my big question, Patrick. Is
Yeah,
that one of the starting points where
I
this
think it's
mechanism
certainly a
is learned?
factor. Do you know, Sean, there's probably a multitude of factors.
Yeah.
We could even point back to maybe anxiety of the mother during pregnancy. Because we know, for example, the heart rate variability of the child is actually determined by the mother. And if a mother is anxious during pregnancy, it will be passed on to the fetus.
Well,
So if you have a baby born with, reduced heart rate variability, we have to ask the question, does that baby breathe a little bit faster and harder? And could then the baby, because of the faster and harder breathing through the nose, that when the baby does have to switch or can switch to mouth breathing, that they do switch to mouth breathing? I don't know. It's only a theory.
yeah, yeah, yeah.
But we also know that children who are born with high narrow palates, so there is a genetic influence here. And a high narrow palate basically is the roof of your mouth. So if you were to put your tongue, for example, into the roof of your mouth like that, and drag your tongue along the roof of the mouth until you reach the soft palate. Now, the roof of the mouth is the floor of the nose. So when people look into the mirror, open your mouth and look up into the roof of your mouth, and sitting above the roof of the mouth is the floor of your nose. Your nasal cavity goes well back within the skull. Now, if you have a very high narrow palate, it means that the nasal cavity is infringed. And when individuals try and breathe through the nose with a smaller nasal cavity, they're likely to feel air hunger, so they naturally switch to mouth breathing. The problem is then that when we switch to mouth breathing, the tongue isn't resting in the roof of the mouth, and it's the pressures exerted by the tongue during the formation, during the formative years, during childhood. We need the lips together and the tongue resting in the roof of the mouth because it's the tongue that helps to shape the top jaw of the maxilla. And if the mouth is open, the tongue is not up in the roof of the mouth because the child is trying to breathe air into the mouth, so has to drop the tongue. And as a result, then we have a narrow top jaw, and overcrowding of teeth is the result. Overcrowding of teeth. This is a new one, Dad. This is new. This is, if you go to a natural history museum, next time you're in Dublin, go to the Natural History Museum and look at the skulls there. And they didn't have overcrowding of teeth. They had plenty of room in their mouths for all 32 teeth. This is very important because if we have sufficient room for all teeth, it's likely then that we have sufficient room for the tongue in the mouth. And when we have sufficient room for the tongue is less likely then to be falling back into the throat. And as a result, then we have a better airway. So, if I was to say in a nutshell, what are the factors that can contribute to mouth breathing? Genetics is, of course, one.
Yeah.
The environment in terms of the food we're eating, the air that we're breathing inside homes, anxiety levels maybe of the mother can influence it. The food so the food we're eating, if the baby is tongue tied, which is often overlooked, they can't breastfeed. And if they can't breastfeed, they don't get the benefits of the exercising the muscles of the face necessary for craniofacial growth. So yeah, there's a number of things, but here's the thing, like, we know that children mouth breathe, but let's fix it, and the dental industry has debated. Now, I'm talking about the dental industry in the main. I'm talking about the people who are setting the curriculum in the universities. I'm talking about, the whole industry as opposed to individual dentists and orthodontists, because there are some tremendous individuals, dentists and orthodontists, who have really pushed this out there. And,
Mm-hmm.
sometimes they've went against the grain and they've said to their peers, listen, we are not doing it. There's things here that we need to improve on. And, you've got egos, you've got politics, you've got power, and you've all this kicking in. And sometimes I think of Max Planck, and he says scientific advances, they only happen when the opponents die out. And then the new generation grows up familiar with the new concept. And
Yeah.
that's amazing, that there's so much resistance to advances. And we should be looking to the airline industry. The airline industry in the first commercial flight back in 1914, and look at the safety record, because they had this policy of continuous advancement as opposed to the bickering and the politics and the big ego, because we have to consider that doctors and dentists they're intelligent individuals, they're armed with medical degrees. How on earth could they be missing something so obvious that the impact of mouth breathing? And not to be debating this. This is not about scientific debate. This is about common sense and logic. Why are respiratory consultants, as I mentioned earlier, not telling their patients, the child who comes in with the mouth open, the adult who comes in with the mouth open, why not breathe through your nose and slow down your breathing? And this is just normal medical physiology. We don't need a randomized control trial on the benefits of nose breathing. Evolution has provided us with it. Let's start copping onto this. And sometimes I get a bit frustrated, Sean, because I feel that, what's going on, and this is only in the field that I work in.
Mm.
And then I have to consider, well, is this happening in every single field of medicine? And if that's the case, well, we're screwed.
Don't worry, there's a Patrick in every other field. Don't worry. I had had a Dr. Fanuna McKeown on, and she went to Trinity, studied medicine, got her qualified GP, and started working. Blah blah blah. And she said, "Well, all I'm doing is just giving pills to the same people, coming back. Didn't feel fulfilled at all. Went off, studied naturopathic medicine, studied nutrition, lifestyle." She's working in the private field now, obviously, because it doesn't really suit Western medicine now. But she has Western doctors every day. Obviously, in Ireland being one of the worst places, what are you doing? And obviously, the same doctors that smoke and drink every night as well. But she knows she's helping people, and she's looking at specifically when it comes to depression and how food's interlinked and all that. I'm working together with all the therapies and what you're talking about. But no, it's not going to waste, don't worry. But it flashes back to me, because obviously myself being an asthmatic and very bad when I was young, always in and out of hospital.
Yeah.
And look at one of my teeth here that's going in of it. I'm like, they definitely probably played a role, what you're saying, in the formation of the jaw and the teeth and stuff like that. Obviously.
Sean, there is like genetics, like I look at my daughter, and she was born with a high narrow palate. And she probably has my genetics. Of course, she's going to have my genetics, but in terms of airway, which is not ideal. But here's the debate. The debate that's going on is it genetics which is causing mouth breathing, or is it mouth breathing which is feeding back into the poor palate? And it doesn't matter, because at 4 years of age, I brought her to a dentist in Cork, Dr. Tony O'Connor, and he put in a light wire appliance called an ALF, and the ALF widened her jaws at 4 years of age, and did it in 3 months. So it doesn't matter. The debate doesn't matter. The fact is that there's a problem here. Let's fix it, and forget about debating. Just action is what we need now. Words have been talked about. It's been discussed for 100 years, and all that time. And like some great dentists, one dentist did this wonderful study back in the 1970s. His name is Dr. E.P. Harvold, and he got young monkeys, 3 different groups of young monkeys, rhesus monkeys, and they were 6 months old. And with one of the groups, he surgically blocked their noses with silicone nose plugs. And I know it's a terrible experiment on animals, but he forced the animals, by blocking their noses, he forced them to mouth breathe. All the mouth breathing animals develop craniofacial abnormalities the same as in humans, the same.
Wow.
And even when they removed the silicone nose plugs and allowed the monkeys to nasal breathe, it took a really long time for everything to correct itself. And parents say to me, God, that's a terrible study on cruelty to animals. What about the cruelty to children? Because there are millions of children partaking in that study today. Yes, they're not being investigated, it's not being studied, but the same consequences. The fact that the children are breathing through the open mouth, and it doesn't need total nasal obstruction to cause mouth breathing. The issue is not whether the nose was fully blocked or partially blocked, or how long does the child have to have the mouth open for before these consequences take place. Let's just put it out there, you know. And Dr. Derek Mahoney has just completed, as far as I know, a PhD on this, just on this specific topic, looking at a large population of children and in terms of sleep and the impact. And it's going to be very interesting. So you can reach out to him, you know, for example. He will have a team who have been absolutely tremendous in putting this out there.
So, in very simple terms, if someone's breathing through the mouth, their body is in a state of stress from a nervous system point of view. They're in a sympathetic state of stress.
Yes.
How obviously
Yes,
awareness is the first step.
Say that.
Obviously awareness is the first step with anything to change. How would people kind of notice if they're mouth breathing or not?
People don't mouth breathe 100% of the time.
Okay.
So, you know, the first thing that I would say to people is, do you wake up with a dry mouth in the morning? And if you're waking up with a dry mouth in the morning, it's evidence that you've been mouth breathing at least for part of the time during sleep. And as I said, 50% of the studied population, typically adult population, mouth breathe during sleep, and it increases as we get older. But do you, for example, go for a mouth if you can walk down the street? If you're watching television, do you have your mouth open? Do you have rhinitis or nasal congestion? Because anybody with nasal congestion or hay fever, it's likely to contribute to mouth breathing. Do you have asthma? That contributes to mouth breathing. And also, do you have anxiety? Because the faster and harder breathing, upper chest breathing with the individual with anxiety, you know, the individual feels they're not getting enough air through their nose, so they switch to mouth breathing. But that only reinforces the vicious circle. There's a wonderful ear, nose and throat doctor from New Zealand called Dr. James Bartley. And for over 20 years, he's been talking about the benefits of nose breathing. And I remember I had an operation on my nose in 1994. I had turbinate reduction surgery. But the surgeons afterwards never told me to breathe through my nose. So I continued actually mouth breathing. And this is another problem, because it's not enough just to treat the obstruction. We also have to change the habit. And with children, the gold standard of treatment for sleep disorder breathing in children is tonsillectomy and adenoidectomy. And it's not a nice procedure. And these children are seldom encouraged to nasal breathe post-surgery. There's a 65% worsening in their sleep within 3 years. 65% chance. You know, so it's just restoring the habit. So I'd say awareness is definitely one thing. Like, if somebody comes into me, I'm looking at their breathing. Are they breathing through their mouth or nose? Are they breathing high? Do you see movement from the upper chest? Or are they breathing low? How fast are they breathing? So how many breaths per minute, for example, are they breathing? What's the amplitude of the breath? You know, are they taking full big breaths with each breath? Is there a natural pause after exhalation? Do they have regular breathing? And, you know, when you get used to it, you look at a person for 10, 15 seconds, you have it. And you do it even without them looking at you, because if the person knows that you're looking at them, they'll change their breathing patterns. And, you know, I suppose somebody will have technology in the next few years, and you have a phone that will have a camera on it and can give you exact information on your breathing, your baseline breathing, and whether it's improving. You know, I think that it's really going to start happening now. Yeah.
So talk to me. Obviously, I've seen some of the stuff where you have the tape around the mouth, and that, and that's just not for the missus when she's talking too much. That's actual use
well, it's
for
been
that.
no harm sometimes. She's sitting here beside me, by the way. So
yeah, I was talking about mine.
She was saying, Sean was suggesting that we should be taping up the missus when she talks too much. So Sean, you just landed yourself in that one, see it, Ed. You didn't realise she was sitting here beside me. She's in another desk.
I'm in Australia, it's all right.
So
what would be the use for that? How do you implement
vital.
that?
Like, we were using 3M 1-inch micropore tape for many years, but the problem is, how do we get children to breathe through their nose during sleep? Because there's a risk there if a child was to get sick. So we brought out a tape called MyoTape. It was for the dental industry, because children who get orthodontic treatment, unless their nasal breathing is restored, there's a 75% chance that their teeth will go crooked again.
Well,
Now, I remember parents in Dublin coming into me, and orthodontics in Dublin is not cheap. And you're talking about 3 and 4 thousand euro. And you will have parents who have saved a lot of money to try and get this money together. The child goes and gets orthodontic treatment at the age of 11 or 12. And if the child continues mouth breathing, the teeth relapse by the time the child is 20. And in comes the
well,
child into me as a teenager or a young adult. And not only do they have relapsed teeth, but they can have an increased risk of sleep apnea, especially if teeth have been extracted during the orthodontic process. So the rule of thumb is never get your teeth extracted. That is the rule of thumb. You have to think that
well,
you need plenty of space in your mouth for the tongue. And if you have 2 or 4 teeth removed in an effort to straighten existing teeth, the fact that you have 2 or 4 teeth removed, your mouth has just got smaller. There's not enough room for your tongue. And where does your tongue have to go then but into the airway? So the myotape, and I'll just show you because
yeah,
this is
yeah.
the one thing that comes up with most people.
Mm-hmm.
Um, how do you get the mouth taped that's safe? So you see it here. It's an
Mm-hmm.
elasticated cotton tape. And there's 2 sizes. There's children's and adults. So I just stretch it and it's surrounding the mouth.
Mm.
And it's the tension by the tape. So the tape is kinesio tape that's going in. So the tension is bidirectional. And this is also helping to activate the muscle here, the orbicularis muscle. So we're getting lip closure because of the elastic tension, both during wakefulness and sleep. And changing the habit of children. Children, you can go through children, you can show them how to decongest the nose. So any of your listeners say, well, I'd never be able to nose breathe because my nose is so stuffy. You can decongest your nose holding your breath for 5 minutes. You'll do it.
Mm-hmm.
Don't do the nose and blocking exercise if you're pregnant. And if you've got kind of serious medical issues, go a little bit easier. But if you wanted to try it, you're taking normal breath in through your nose, a normal breath out through your nose. You pinch your nose with your fingers and even just gently nodding your head up and down, holding your breath. And keep nodding your head up and down, holding your breath until you feel a medium air hunger, strong air hunger. Then let go, breathe in through your nose and do that a few times and your nose opens. Now, it's only temporarily because your nose will be more permanently free when you improve your breathing patterns. So say, for example, when the person's bolt score or controlled pause, but basically it's the length of time of their comfortable breath hold. If they have a comfortable breath hold time of 20 to 25 seconds, they're much more likely to have a free nose. So if a teenager comes into me, I'll say, listen, you have a stuffy nose. It's impacting your sleep. It's causing you to mouth breathe. It contributes to bad breath. So this will motivate teenagers. You're more likely to gas out during sports because an athlete who is gassing out, or if you have an athlete, say, with poor breathing patterns during wakefulness, and that athlete is breathing a little bit faster and a little bit upper chest, that poor breathing pattern is going to translate into poor breathing during sports. So that individual is more likely then to have disproportionate breathlessness. They gas out too soon, but there also it can affect muscle fatigue, including fatigue of the diaphragm, because they're overworking and incorrectly working their breathing muscles. And if you overwork the diaphragm to the point that the diaphragm gets tired, blood is stolen from the legs to feed the diaphragm, and the legs will give out. So from a breathing perspective, we're motivating teenagers and we show them all of the exercise. And I say to the kids, I say, listen, you've got 2 choices. You build up your breath hold time, your bolt score or your controlled pause, or you'll have nasal congestion. Your teeth are impacted, your facial features. And I don't say to the kids, you go around with your mouth open, you're going to have an ugly face and your nose is going to be crooked like mine and jaws are, we don't say that, but we say, listen, to look intelligent, for your face to grow the way it needs to grow, your lips must be closed and your tongue resting on the roof of the mouth. So I suppose, it's addressing the habit, and that's why we introduced then taping of the mouth during wakefulness, especially for young children, 4 years of age. The child is sitting watching television, their mouth is open, they're breathing through it. And if they're wearing a tape, every time that they forget to breathe through their nose, when they switch to mouth breathing, the tape will remind them to bring the lips together and that will help to continue nasal breathing. So it's about changing the nasal or the mouth breathing habit, the nasal obstruction, and the breathing pattern disorder. Three things.
Now, I'm about 25 years too late, but all this stuff is mind blowing for me because obviously having asthma as a kid, I was one of the fittest sports people, obviously, in my whole year. We used to go to the gym with the lads, and there was a swimming pool at the gym, and we used to practice holding our breath. And my mate, who smoked full time, pack of cigarettes a day, could hold his breath longer underwater than me. And I used to just find it mind blowing. I know, I do know most swimmers were asthmatics themselves. So you're obviously saying that the bolt score is being able to hold your breath for a long period of time. And by what kind of quote unquote training would you do with someone to improve that?
There's no question that people with asthma have a lower breath hold time. No question. And what the reason there is because if there's inflammation of the lungs, it's fed back to the brain, and the brain is picking up on that, and it reduces breath hold time. Other factors that influence breath hold time would be chemosensitivity to carbon dioxide. So, for example, carbon dioxide is a gas that's in the blood, and it's produced as a result of our metabolic activity. And if we have a high sensitivity to carbon dioxide accumulation, our breathing is faster and harder because it's carbon dioxide that's the stimulus to breathe, not oxygen.
Yeah.
So it's only when our oxygen levels drop by about 50% does the drop in oxygen drive our breathing. So there's no coincidence that people with asthma resort to swimming. And the reason being is because it's the one sport which is forcing them to breathe less. And by forcing the person with asthma to breathe less, their airways open up. We have to bear in mind that the first clinical trial in the Buteyko method in asthma was at the Mater, outside of Russia, was at the Mater Hospital in Brisbane in 1994. And they looked at they had 170 people initially, but by the time they matched them and got them into different groups, two groups, it was down to 19 in the Buteyko group, and 20 were doing the in-house hospital program for breathing at the Mater Hospital. It was physiotherapy led. And minute ventilation on both groups was 14 litres during rest, 14 litres per minute during rest. Normal minute ventilation is 4 to 6 litres. So here you have a group of people with asthma, and in both groups, they are breathing 2 times more, at least, than what they need. So that is not evident. It's not that they're having an asthma attack. This is their breathing in between attacks. This is their resting everyday breathing. So they are breathing a little bit too fast and a little bit too hard. After 3 months, and the therapist involved with this was, I think it was Tess Graham actually, she's a physiotherapist in Sydney. In the Buteyko group, the minute ventilation reduced from 14.1 litres down to 9.6. That was after 3 months. They had 70% less symptoms. They had 90% less need for bronchodilator medication, and they had 49% less need for inhaled corticosteroid. And there was a direct correlation between the reduction in minute ventilation and the reduction in symptoms. Now, carbon dioxide levels didn't change by all that much. They increased in the Buteyko group by maybe 1 or 2 millimeters of mercury. And in the control group, and we have to bear in mind, this is the hospital program that's taught inside in the Mater Hospital in Brisbane back in 1994. It had 0% change, nothing, absolutely nothing. And the reason that it had no change, and you'll find this was published in 1998. It took 4 years for this trial to be published. So it shows that there was some resistance as well to the trial being published. It shows you, though, that the only reason that the in-house hospital program was not as effective as the Buteyko program was because minute ventilation wasn't reduced. So Buteyko was all about, Dr. Buteyko basically said, he says, people with asthma, he says, noisy and deep breathing is not because of the asthma. It's causing the asthma. He said, it's not just that the person with asthma is breathing harder and faster. And if you look at most people with asthma, even when they're under good control, they'll still have a little bit faster and harder breathing. That's feeding into their symptoms. And, you know, the whole debate is it carbon dioxide? Is it not? Well, the carbon dioxide wasn't increased, so we don't want to know about it. It's not about that. Look at the results. These people also, they had the same lung function at the end of 12 weeks as they had beforehand. But but with 49% less need for inhaled corticosteroid. And it just improved quality of life and improved control of their asthma. And I remember Dr. Patrick McKeown, he's a GP from New Zealand who was also involved in a couple of trials there. And he said that not only will it improve asthma control, he said, in quotes, it could save lives.
Mm-hmm.
That's what
Yeah.
it's about.
Yeah.
But it hasn't, how many people now know about Buteyko in Australia? No, I
Mm.
assume not that many, and
Mm.
how many people have asthma? We're talking about probably about 10% of the population. So what's the
Mm.
population there? Is it 26 million?
Yeah.
So could it be as high as 2 million people in Australia have asthma and a half a million in our little country having asthma, and yet they're not aware that their breathing is feeding into their condition? And I approached the Asthma Society of Ireland in this back in 2004 and 2005. And I went to an asthma conference back in 2005. And there was a panelist of doctors on the high table on stage. And I remember the CEO of the Asthma Society sitting beside me at the conference. And I says, God, I was only in my 30s at the time and I was only new into it. I would have been too shy anyway to start
Yeah.
asking questions.
Yeah.
But she says, Patrick, she says, you're not to ask any questions. So that was what I was experiencing 15 years ago, 16 years ago. So it was total resistance. And why? I'm not here to replace medication. All I'm here is saying that, why have kids with asthma?
Mm.
Why let them mouth breathe? Why let them breathe dysfunctionally? Why let adults with asthma and breathing complaints breathe dysfunctionally? Why not help them? And this is not about the Buteyko method. This is recognizing that if you're breathing with an open mouth, if you're breathing faster and harder, the nose is the only organ for the human body that's there to help the lungs. And, in 1988, a researcher called Swift, they measured the SaO2, sorry, not the SaO2, the PO2, so the pressure of oxygen in the blood in millimeters of mercury. When individuals were forced, that basically they had jaw surgery, and post-jaw surgery, their jaws were wired shut. So they were forced to continuously breathe through the nose. The PO2 of the blood increased by 10%. Now, when we're talking about breathing conditions where poor gas exchange can be the problem, why not change breathing patterns that we can improve that? And also, if we think of the connection between the mouth and the chest, nose breathing will typically bring the air lower into the lower regions of the lungs. And it's in the lower regions of the lungs that the greatest concentration of blood flow is. And also, when you breathe through your nose, you're harnessing a gas called nitric oxide. So nitric oxide is produced probably in the paranasal sinuses and the nasal cavity. So when you breathe through your nose, you're carrying that nitric oxide into your lungs. Nitric oxide is a bronchodilator. It's an aerocrine messenger for the upper airway dilator muscles during sleep, but it also helps to redistribute the blood throughout the lungs. So nasal breathing is improving the gas exchange from the lungs into the blood. And then if you do physical exercise with your mouth closed, when you do physical exercise with your mouth closed, your nose imposes a resistance to your breathing that's 2 to 3 times that of the mouth, simply because your nose is smaller. And this forces your breathing to be slower. And by doing that, carbon dioxide increases in the blood, so you feel more air hunger. So it's true when you go for a walk, even with your mouth closed, or a jog, you're going to feel a little bit more suffocated. You feel more breathless, but this is just initial. And the increased air hunger signifies that carbon dioxide is increased in the blood because carbon dioxide is the primary stimulus to breathe. But as carbon dioxide increases in the blood, your blood vessels dilate. And not only do your blood vessels dilate, so your circulation improves, but also you have what's called the right shift of the oxyhemoglobin dissociation curve due to the Bohr effect that was discovered back in 1904, that red blood cells release oxygen in the presence of carbon dioxide. So the person who does their physical exercise with their mouth closed and they're feeling this increased air hunger, carbon dioxide is increasing in the blood, it's improving their blood circulation, but it's also increasing oxygen delivery from the blood to the tissues and organs. And even that's why not during physical exercise for all people with physical exercise. And it was an Australian researcher back in 1995 called Morton, Morton, that investigated nasal breathing during physical exercise and found that the fraction of expired oxygen was less when you breathe through your nose. In other words, the oxygen that you bring into your lungs, the body utilizes it better when you breathe through your nose than when you breathe through your mouth. So when you breathe in and out through your mouth, you get rid of more oxygen that your body is not able to utilize it as effectively. Um, yeah, and I understand people will say, well, I'm feeling really strong air hunger. The air hunger is normal for about 6 to 8 weeks. But if you continue doing your physical exercise with your mouth closed, and the air hunger diminishes. And the other thing that we'd say is for some athletes is to get nasal dilators. Like we have little products in terms of a little thing that helps to open up the nose. And there's other products in the market. Breathe Right strips is one. The Turbine is another one. Our one is just called nasal dilator. And you'll see any of them. But all they do is help open up the nose. So, for example, if you do this, if you put one finger here and one finger here, and if you just gently prise your nostrils, you'll feel that your breathing is easier. And that's based on the Cottle maneuver. So if you have somebody with a very compromised nasal airway, they may need just to have a little bit of a device, and they're very, very cheap, a few dollars, and it
Yeah.
helps open up the nasal airway that they can sustain nasal breathing.
Amazing. I've just been doing it actually since coming across your work the last few weeks. All my low aerobic, I'm finally at the stage where I can run, keeping the heart rate well 150 and being able to just nasal breathe the whole way, which is, again, for some asthma, you're just literally retraining your whole system.
Yes.
But obviously practice makes perfect when it comes to that. And
Yeah.
obviously, just like you said, ironically, the pandemic we're going through now is a respiratory one, and
Yeah.
you're talking about everything that improves your physiology, your immune system. Obviously, your nose filters the bacteria what goes in, what you breathe in as well. So, what I want to talk about is not only for asthmatics, but the kind of vicious habit loop and chicken egg scenario between baby are stressed people that get more anxious, and then obviously mouth breathing in general. When I was a kid, my mum she used to notice that when I would get tight, naturally breathe, shoulders up into my ears, scaling, just everything's fired up, my neck muscles. She
Yeah.
noticed that, and obviously now you can physiologically explain why. But not only for asthma, but how does the habit loop start? And the same way, the chicken egg scenario, we can de-stress ourselves and anxiety through our
Well,
breathing as well.
if we bear in mind what the literature says, that 75 to 80% of people with anxiety, and included in that are people with panic disorder, and I'd also include people with a racing mind. So these are individuals that may not necessarily be labeled with anxiety, but they have a lot of emotional turmoil, just that their mind is quite active. How can we help address that? And for me, I think this was the one of the biggest things that ever I brought into my own life, going back 1998, 23 years ago. And I came across it by accident because I had a racing mind. Many people in Western society have a racing mind. And I think a lot of it is due to the pressures that society puts on teenagers, achieving exams. Then you have to go and get a degree, and you have to go and do this, and then you have to do this, and all this crap that people in society is putting on us, which is normal. So the mind was racing. And I remember going in to give it, I wasn't giving a talk, I was going in to listen to a talk. It was in the Shelbourne Hotel in Dublin. And it was presented by two individuals. And I sat there with another group of people for about 1 hour, 2 hours. And they were talking about presence. And they were talking about bringing your attention into the present moment awareness. And obviously the presenters were immersed in presence themselves. And when I left that hotel, I walked down Grafton Street on my way back to get the bus. And it was the first time I actually seen the street that I had a stillness of the mind, because before that I was constantly living in my head. Now, the next morning I woke up, the mind was chattering again, but I got a glimpse of it. And that was the first thing that I realized, that something, that this was the first time. And now, you know, I think really education should be talking about this, and not just talking about it, but actually doing it. But then again, and it's not a blame of the teachers, it's the blame of the industry, it's the people who are setting the curriculum.
Yeah.
We're being taught how to think. Education is teaching us how to think and to reason and to analyze and decipher and break information into tiny pieces. And it's almost that we're training the brain to think, but we're not training the brain how to stop thinking, how to bring a calmness of the mind. And only with a calmness and a quietness of the mind do we have concentration. And if we think of concentration as a skill or as an art form, this would be the one of the most valuable skills that anybody could have for their entire life. You think of the child, and as I was the kid in secondary school, poor sleep going in, attention stuck in my head. I'd be reading a book, but my attention wasn't on the page because I'm stuck in my head. Get to the bottom of the page, don't remember any of it, have to start off again. So when you have poor concentration, you have to spend a lot of time putting your attention on doing what you're doing because your attention is pretty poor anyway. So coming back to it, what skills or what would I say to people? Mindfulness is brilliant, but it doesn't work as effectively for the very group that need it most. Because if your mind is anxious, how on earth can you have your attention on your breath? When the mind is all over the place. Instead, we want to address respiratory physiology. And cognitive behavioral therapy doesn't change respiratory physiology. This was studied by a researcher called Moret back in 2010. And she did a control trial comparing the effects of cognitive behavior, CBT, and respiratory physiology, slow breathing. And she found that the panic disorder and the feeling of suffocation that often originates with people prone to panic, CBT doesn't change that. So CBT will challenge the individual. Well, have you ever died from the feeling of suffocation? Or, and the person saying, no, I haven't, I'm still here. But it tells the person that the symptoms exist, but doesn't actually help them address the symptoms. But if you look at your breathing, say, for instance, from a biochemical point of view, somebody with anxiety, start breathing through your nose, first and foremost. And what I would say is when you're sitting down watching a little bit of television, or just in, the comfort of your own home, put one hand on your chest and one hand just above your navel and start gently slowing down your breathing. But slow it down so that you breathe a little bit less air and a little bit less air to create a feeling of a slight air hunger. And only do it for maybe 15 to 20 seconds just to see how you respond to it, because you're deliberately reducing your breathing to bring on a little bit of a feeling of air hunger or suffocation. Now, the suffocation is just because carbon dioxide is increased in the blood. But remember what this is doing to your blood circulation, because it's very common with people with poor breathing to have cold hands and cold feet. And the reason that they have cold hands and cold feet is because blood vessels are constricting due to their harder and faster breathing. So to improve blood flow to the brain, which can have a calming effect on the central nervous system, you breathe a little bit less air. Okay. So practicing that, I'm only kind of just putting a couple of snippets out there.
Yeah.
Practice that and see how you do, and just see, can you improve the blood circulation in your fingers? And remember, your brain is getting more blood flow and oxygen. Now, the very fact of practicing that exercise, your mind is also more anchored onto your breath. So from a meditation point of view, you're actually doing meditation in terms of anapanasati, or just following your breathing. So maybe practice that, and then when you feel comfortable, you could then, for example, start engaging the diaphragm. Check if you're breathing upper chest or if you're breathing low. And even if you were just to place two hands either side of the lower ribs, not necessarily to the front, but just at the sides, because you want to see, can you get lateral expansion? Because the lateral expansion of the ribs is a gauge of what's called a generation of intra-abdominal pressure. And it gives you feedback of that when your diaphragm is moving downwards during the inhalation, you'll have some movement to the front, some movement to the back, and some movement to the sides. And it's the connection between the diaphragm then and the emotions and calming the breath. And then slow down your breathing. So another practice you could be doing is breathing again in and out through your nose, slowing down your breathing to 6 breaths per minute, because 6 breaths per minute is the optimal in terms of stimulating the vagus nerve. And when we stimulate the vagus nerve and we improve the sensitivity of the baroreceptors, which are pressure receptors in the major blood vessels, and it's the sensitivity of the baroreceptors which give us really good feedback of the functioning of the autonomic nervous system. So we do slow breathing. You could do it 5 seconds in and 5 seconds out, or if you feel quite breathless, start off with just doing 3 seconds in and 3 seconds out, 3 seconds in and 3 seconds out. If you're comfortable doing 5 seconds in, 5 seconds out, do it that way. You're breathing in and out through the nose, and breathe low. And you shouldn't hear your breathing during this time, because there's no need for you to hear your breathing. So the benefits of improving heart rate variability, which is a clinical measure of vagal tone, is that it helps bodily systems disturbed by stress to recover. And individuals with anxiety and depression and PTSD, um, they typically will have reduced heart rate variability. So we can influence the autonomic nervous system, and really, when I think about breathing, I'm thinking about the impact that we have not just on mental health. We spoke about respiration, but we also, in terms of sleep. And I always think of, Sean, people coming into me with depression over the years. And in 2010 to 2013, I had 3,000 people come in with panic disorder and anxiety.
Mm-hmm.
Now, I made plenty of mistakes. I put people into panic attacks. I increased stress levels in some. And, it taught me a lot in terms of it's not a one shoe fits all. And a lot of people are doing stressor exercises and hyperventilation and long breath holds, and maybe they may not be suited to that. Some people are suited to the stressor exercises. Some people need to be downregulated. Some people need to improve their sleep. Like someone comes in to me, and I use it in the new book, an example. I had a woman in her 30s, and she came in with depression. And I just asked her, I said, how do you feel when you wake up in the morning? And she says, I wake up totally exhausted. And I said, has anybody ever asked you about your sleep? And she said, no. Now, she has been suffering for depression for maybe 10 years, even 20 years. Nobody has questioned her sleep. And I think what's happened there is that the healthcare professional has assumed she is exhausted because of her depression. But she hasn't, they haven't asked the question, could this person in front of me, having the two go hand in hand, it increases the risk of depression.
Mm.
So is it the depression which is causing the exhaustion, or is it the exhaustion which is causing the depression? And I'll also say that you do not achieve a calmness of mind unless you have good breathing and good sleep. You cannot achieve it. So let's start looking at mental health aside from CBT. CBT, great, it's one pillar. Let's look at breathing from a biochemical point of view, biomechanical point of view, resonance frequency point of view. Let's look at sleep, and let's look at nutrition. And I don't want to overcrowd and say that you should be doing 10 things, because then it gets too much for the individual. But maybe just start off with one. And if from a breathing perspective, I'd say start off breathing through your nose and get your mouth closed during sleep. And if you get your mouth closed during sleep and you're waking up with a deeper sleep, that's going to be huge. Because if you have a deeper sleep, it's a good start to the day. And in terms of recovery and resilience, and objectively, this has been measured with heart rate variability, in total, we have about 700 instructors. And in 50 countries, 400 are through the Buteyko channel and 300 are through Oxygen Advantage. And many of them are technology. I'm not a fan of technology. I'm not great with it. But they will feed it back that if they're wearing their Oura rings or their Whoop, and when they change their breathing patterns, the impact it's having on their HRV. So it's out there. Mm-hmm. And what I'd say is, for people with anxiety and for a racing mind, look at your respiratory physiology. But even aside from that, how about the person who just wants to improve their focus and concentration? The normal person that doesn't consider they have any anxiety or anything like that, but they want to improve their capacity to hold their attention on what they are doing. And that's focus. And if we're living in our head, and if our mind is bombarded with thought, we don't have the capacity to hold our attention on doing what we're doing. How do we bring a calmness and a quietness to the mind so that we can concentrate on what we need to concentrate upon? With that, we can train the brain, start focusing on your breathing. And as you focus on your breathing, you're bringing your attention into present moment awareness. Too often, we as human beings, we are missing out on life because we are not experiencing life, because we are stuck in our heads. And the education system really needs to get on board with this one. It's not just about teaching people how to think. We also need to teach people how to stop thinking. And I don't mean to stop thinking that they are a vegetable, but I mean to stop thinking that they have the capacity to focus on what they want to think, and also that they can select between productive thinking, which is useful, and we as human beings need to be able to plan and decide and make decisions. But it's about quietening the mind of the repetitive and unproductive and often self-critical thinking. And social media has not helped with this one. There's a lot of pressures now on young teenage girls. Suicide rates have increased, unfortunately, since 2009. And, it's really something that we need to start looking at this.
Yeah, even when I look at TikTok, I just get stressed out looking at that, knowing that's out there. But no, you'd be happy to know that there's a lot of my colleagues over here that actually one of the first things we do is not only address the posture of someone's breathing, how that can affect, as you said, we'll get into that maybe the next time, but teaching them how to breathe, and then we're working in CBD, obviously dealing with more stressed individuals. Our focus is going more towards this than the killing them aspect. It's slowly becoming a bit more mainstream. Obviously, everyone's looking for the best training method, what's new, but obviously, like you were saying, you sleep. Most people can't recover it to be able to train hard anyway. So all the stuff you're talking about now, it ties into that beautifully. Now, the last question, because I don't want to use all your time. Where did the American movies where they breathe into the paper bag, where did that come from?
Well, so physiologically, it makes sense in terms of panic disorder. Because the person with panic disorder, when you look at their everyday breathing, it's typically fast and upper chest, and they sigh. They sigh quite frequently. So their everyday breathing is not good. And because of their irregular breathing patterns, they can have fluctuations in carbon dioxide because, of course, the gas CO2 or carbon dioxide in the blood is determined by the volume of air you breathe. And even if you take one big breath, one big sigh, that can lower CO2 in the blood. I think it's by about 7 to 8 millimeters of mercury. It's quite significant. Now, if you have somebody then prone to anxiety and panic disorder with a poor breathing pattern, these people then are teetering on the brink of symptoms. They go and drive their car. If they get a bit stressed, the additional stress on top of their already poor breathing can put them over the edge, or a crowded place. So traditionally, the brown paper bag was about cooling. The person breathes into the bag. They're breathing enriched gas, carbon dioxide. So their exhale breath is CO2. Typically, it is about 5% carbon dioxide. That's breathed out into the bag. But then on the breath in, they're carrying that carbon dioxide enriched air back into their lungs. And the higher CO2 in their lungs then will increase CO2 in the blood, which in turn is going to improve blood flow to the brain, which is a calming effect on the central nervous system. Now, the only problem with the brown paper bag is that it's not safe. And last night, funny enough, I had our own instructors and we were going through it too. If you have somebody that's prone to a panic attack, if they're having a panic attack, what do you do? Number one is you could start them, just get them to cup their hands. Cup their hands to pool carbon dioxide, but you also know there's plenty of oxygen going to come in through the fingers. So their oxygen levels will remain normal, even though you're pooling carbon dioxide. And the other thing is, anytime that we have a breathing related problem, a hyperventilation attack or panic disorder or an asthma attack, there's a strong feeling of air hunger and suffocation, people with COVID. And to alleviate that, the normal response is to breathe fast and shallow. It doesn't work. Fast and shallow breathing is not going to alleviate the feeling of air hunger. You need to breathe slow and you need to breathe low, and ideally through the nose. That in turn can improve gas exchange. And this also can improve recovery during sports. So for example, MMA fighter or boxer, they're doing their round, they have a 1 minute rest, 1 minute for recovery. How do you get recovery in that time? It's all about slow breathing. How can you lower the heart rate? Well, you have to think about how does the heart rate lower in terms of the breath. When you slow down your breathing with a prolonged exhalation out through the nose, this in turn will stimulate the vagus nerve, which will release a substance called acetylcholine, which will cause a slowing of the heart. So we can improve gas exchange, we can improve recovery, and we can also help it with mental health. There are exercises to upregulate, downregulate, exercise for kids. And, we have a suite of 26 exercises minimum. And the benefit of that, then, it just gives me a better toolbox and it gives our instructors a better toolbox. Because if you're just reliant on one exercise, it's limited. And it's not just about improving your breathing while the person is inside the studio with me. I want to find out, how is that person with panic disorder? How are they breathing when they're asleep? How are they breathing when they're walking down the street? And this is a condition too. If you're fearful of having a panic attack, like I have never experienced a panic attack, touch wood. And I never realized that, yeah, if I deliberately reduce my breathing and I feel air hunger, it's a bit uncomfortable. But if a person who is prone to panic disorder, if they're feeling that suffocation, they have a really strong reaction to that feeling of suffocation. It's not air hunger. They feel that they are going to die.
Mm.
And that's what we have to consider. How is that person feeling when they're having that panic attack? And this is where deliberately we also do desensitization, because during the reduced volume breathing, we are deliberately having them reduce their breathing a little in order to increase carbon dioxide in the blood. And the purpose is to improve blood flow and to reduce their chemosensitivity to carbon dioxide. But in doing so, we're exposing them to a feeling of air hunger. So the person comes in with panic disorder. I'll give them 15 seconds of air hunger. And they get used to it. And then say, 15 seconds, how is that? Yeah, it wasn't too bad. Okay, we'll have a rest now for a while. And then we might give them 30 seconds of air hunger. And I give them a teaspoon of air hunger. And by giving them a teaspoon of the air hunger, we're able to desensitize their body's reaction towards the fear of suffocation. Because the other thing about this is, if I was at home and I'm thinking, well, I want to go down to the shop, but God, I don't know if I want to go down because I'm afraid I might have a panic attack down there, I'm not going to leave the house. And this is where agoraphobia is coming in. And people then with agoraphobia, again, dysfunctional breathing patterns and low CO2 play a role here as well. So, and I'm not saying that CO2 is the only thing that's going on here. It's not, but it's certainly one factor. And faster breathing and upper chest breathing, that too can arouse the emotions. So, again, that's why we want to look at breathing from the three-dimensional point of view of functional breathing. And, like looking at it from the biochemistry, the biomechanics, and resonance frequency breathing, I think it just offers us that little bit more of a toolbox.
100%. Yeah, there's so much to get in there. And obviously, like you've talked about genetics, and the last point, epigenetics, which I've heard you mention before. From a point of view of my breathing and asthma, I know if I go drinking and eat shit and don't sleep, oh, my asthma is so bad. I have to be in a state where my behaviours are a certain way. For some people, it may be their mental health.
Yeah.
They need to have certain behaviours to keep that at bay or to keep it in check. And that's as you said, it's the multifactorial approach. So interesting. You're doing phenomenal work, Patrick, 100%. Where can everyone find your work? Obviously, your amazing books.
Yeah, so thanks, Sean. Instagram, we've got a channel, Oxygen Advantage. That's kind of performance driven. So for people with sports and athletics, etc. And then for health, we've got Buteyko Clinic. And I have a new book that's just coming out on the 15th of February. It's called The Breathing Cure. And it's a very significant book. It's 190,000 words, so it's 500 and something plus pages. And it's for everybody. It does contain the science, but I've made it as digestible as possible for the normal everyday reader. And we've put in sections on diabetes, because again, the people with diabetes was overlooked, epilepsy, and the impact of breathing on that, sleep, childhood development, women's breathing, functional movement you spoke about. You can't have functional movement unless you have functional breathing, asthma, COVID, 26 breathing exercises included in it. So that's one aspect. So yeah, so butekoclinic.com is one, and oxygenadvantage.com. And for children, we have all our videos are free for kids. So if you just put in Patrick McKeown children's breathing exercise, you'll see them all up on YouTube. And parents can sit down with their child. The child is the stuffy nose, show them how to decongest the nose. The child is anxious, how to help slow down their breathing. If a child has asthma, because the one thing that I wanted was, I didn't want children, genuinely, I didn't want children going through the life that many people have had to go through because of their asthma and because of the failure. One of my dogs after coming in here now is after making another. This is the joys of having your office next to your house. You have every creature coming in. So I didn't want children going through not being able to, get the use of breathing exercises because of finances or anything like that. So we want to make them available. So that's why the whole thing is up on YouTube. Just put in my
Amazing.
name, Patrick McKeown, children's breathing, and you'll see 7 or 8 different exercises there, 9 exercises.
I'll link everything in the show notes as well. Unbelievable. Absolute phenomenal, Patrick. You're doing amazing work. So, from all our perspectives, keep it going. Very inspiring.
Good stuff. Thanks very much, Sean.
Thank you very
Thanks
much,
for the
Patrick.
opportunity.
Appreciate it a lot. I'll see you soon.